who's here in Cairo as the emergency coordinator for the Gaza response. After more than 3 months of war on Gaza, the suffering of Palestinians trapped in Gaza can no longer be put into words. The indiscriminate Israeli bombings have destroyed buildings and entire neighborhoods in the north of the Strip, reducing them to rubble. The bombing campaign has moved on the middle area as well and the south with increasing brutality. Over 22,000 people have died and over 55,000 have been wounded so far, as well as 7,000 to 8,000 estimated to be under rubble. According to the local health authorities, over 1.9 million people in Gaza, representing nearly 85% of the population, are estimated to be forcibly displaced in unsafe, unhealthy conditions, while no place is safe from the bombing. People in Gaza need a sustained ceasefire now. It is the only way to stop indiscriminate killings and civilian injuries and allow for delivery of desperately needed humanitarian aid on a meaningful scale. Attacks against hospitals and civilians must stop immediately. Therefore, working purposefully to reach a ceasefire is the most effective way to ensure this. Without further delay, I give now the floor to Enrico Villaperta, who's MSF's medical referent in Gaza. Enrico is an Italian intensive care nurse working with MSF for several years now, covering various contexts around the world, including South Sudan, Ukraine, Iraq, Syria, and the Gaza Strip in previous wars in 2021. Enrico, the floor is yours.
Thank you very much. So what I want to do is just explain, to tell you what I did in this month that I spent in Gaza. I've been in Gaza 2 years ago, was a completely different world. The Gaza that I remember was a small area, because Gaza is a small area, full of people, but with people that could have, I could say, a normal life. What I saw now is a place that is destroyed. What is not destroyed is completely full of people. Packed of people in 2 million, almost 2 million of persons that are trying to survive in a few square kilometers. I entered in Gaza exactly 2 months ago. I've been in Al-Aqsa hospital in the middle area for 20 days. I restarted the activity that the previous team started in Al-Aqsa hospital, and we were doing mainly post-surgical management of the patient. We were focused on very complex wound. We have an OT to treat this patient. We were doing orthopedic and plastic surgery and physiotherapy, mental health promotion. So everything that was needed to support all the patients that had surgery and to try to support the hospital in a context that was that no one saw before. Al-Aqsa Hospital is the main hospital of the central area, of the middle area of Gaza. A hospital with the normal period has 240 beds. When arrived, there were more than 650 patients. And added to this patient, there were thousands and thousands of refugees. They were living in the hospital or mainly in the area between the building of the hospital and the external wall, because the hospital is considered the less unsafe area in Gaza. That is not a safe area, it's just less unsafe. So who could fit inside the hospital was going there to be more safe. Obviously, this was a huge problem because to think to give assistance to people when you don't have the space to move, the beds are one completely close to the other. And so in a hospital that is fully packed is really challenging. Challenging in terms of healthcare, but more challenging in terms of infection and management of everything. All the system, all the infrastructure was not ready for to have thousands of people inside the hospital. After 20 days that I was there, exactly the 6th of January, we had to evacuate the hospital. Why? Because in the last days, the situation was becoming worse and worse, or more tense and more tense. Every day we saw that the ground operation, the bombing was always close to the hospital. And we arrived the 6th of January that there was an evacuation order of the blocks at 200 meters from the hospital. So the situation was too unsafe. It was unsafe for the staff that was coming to work, and every day they were facing more and more problems, and more risky situation. To reach the hospital was unsafe because they arrived to bomb to 150 meters from where we were. So we couldn't continue to work in a safe context. This has been a pretty heartbreaking situation because to decide to evacuate means to move all our staff out of the hospital, means to leave the patient, because you cannot move. That moment there were more than 700 patients. You cannot move 700 persons to move nowhere, because there is no a place where they can go safely. So we decided to go in the south. After 2 days, we faced another difficult situation. That was a shelling of the guest house, of the shelter where were living part of our staff. Was a shelter with more than 100 staff and families that has been shelled. And fortunately, the bomb that went through didn't explode. And I say fortunately, but a daughter of one of our driver lose the life, as killed. If this bomb should have exploded, it will be a massacre. And this is a demonstration that there is no place that is safe in Gaza, absolutely. In the south, what I did in the south in the last 10 days that I've been there, I left yesterday, was to try to reorganize some activity to give more support to the hospital in the south, but there the situation is you cannot describe. You have now there are 1.8 million of people that are living in a place that is completely crowded. People is living under really plastic sheet, and with the temperature that in the night are lower than 10 degrees. Is sometime mainly in the night is raining, is very cold. So I don't know how they can survive, how they are surviving, because we were a little bit more lucky. We had a house where we could stay. It was very cold in the night for us. I can imagine for them that were living out in the road. The situation is going worse day by day. Access to food, access to healthcare is challenging, is more and more challenging. If there is no ceasefire, really now the situation can only deteriorate and go worse and worse. I would say that as an introduction of what I did could be enough.
Thank you so much, Enrico. I just want to point out that interpretation is available in this via interpretation channels. فلو احتجتوا ترجمة please يعني استخدموا القنوات الخاصة فيها. We move now to our next speaker, Helen Peterson, who's MSF's emergency coordinator for the Gaza response here in Egypt. Helen is an MSF nurse. She joined MSF back in 1997, and she's worked in various contexts in the Middle East and beyond, including South Sudan, Syria, Lebanon, Turkey, and Indonesia. Helen, the floor is yours.
Good afternoon, everyone. Thank you very much for the opportunity to speak about our activities in Gaza and our support activities in Egypt. First of all, I'd just like to say that MSF has been present in the occupied Palestinian territories for more than 20 years, including Gaza. So we had surgical activities, limb reconstruction, burns care for patients who'd been injured in the previous conflicts, just to give some history. Currently, in Gaza, we have several medical activities focused in different hospitals in different locations, scattered all over the Gaza Strip. So we have a small team in Al-Awda Hospital in Jabalia in the Northern Governorate. We're supporting 2 hospitals in Khan Yunis, European Gaza Hospital and Nasser Hospital. We also have several medical activities in health structures in Rafah, in the south, and also in middle area we have a small team of staff remaining in Al-Aqsa Hospital in Deir al-Bala, which is where Enrico was working recently. In terms of the types of activities, they range from surgery, post-operative care, maternal health, deliveries, pre- and postnatal care. We're also providing wound dressings, physiotherapy, and mental health to the patients that we're receiving in the various medical facilities. In terms of Egypt, our mission here is really to support the activities in Gaza. It's a back base. That's the office which I'm heading. Our objective is to support the medical activities with supplies. And to date, we've sent 107 tons of supplies into Gaza via the Rafah border. Most of those supplies have been medical supplies, but also including some food and logistics supplies, etc. Our other main objective, of course, is to support the entry and exit of international medical staff, Enrico being a good example. So yeah, that's an overview. I'd just like to take the opportunity to pay tribute to the medical staff, the Palestinian medical staff, who are still hanging on bravely, working in Awda Hospital in Jabalia, in Nasser Hospital, and in Al-Aqsa Hospital. These people are working at incredible personal risk. Some of them haven't seen their families since the beginning of the war. They're working, under siege, in incredibly dangerous and harrowing conditions, and I would like to pay tribute to their courage and to their commitment. Thank you very much.
Thank you so much, Helen and Enrico. Now we open the floor to questions from journalists in the room and those online. I can see already some journalists joining us from Libya and other countries. So please, the floor is yours. Make sure that you introduce yourself and the media institution that you represent. And we also thank you to keep the questions as short and precise as possible, so we digest as much as possible of the questions. I also want to mention that we will give you the floor to also do one-to-one interviews after the presser. So any questions?
My name is Sarah Ben Haida and I work for the French news agency AFP. I would like to know first if we could have an idea how many doctors or nurses or personnel from MSF could make it into Gaza since the beginning of the operations, and what are your main needs now? Do you need more people in? Do you need more medical equipment, and what are the main challenges? I mean, what are the surgeries you have to do? What are the kind of wounds you're witnessing over there?
Thank you. So in terms of international medical staff, we have a cap of around 20. This, I believe, is linked to the incredibly insecure conditions and the constraints on the ground. So we have rotations several times a week, getting people in and out, and people are staying on average for 1 month and then rotating with a new team. Of course, we would like to scale up. This is a drop in the ocean compared to the medical needs. We really would like to have large-scale operations everywhere. The needs are enormous and overwhelming and increasing. But the current conditions, the lack of humanitarian access, the lack of deconfliction of movements, the attacks that we've seen on health infrastructure and the civilian population make it extremely difficult for us to operate in a way which matches the needs in Gaza currently.
I finish for the second part.
Yeah, we have a question also to Enrico from Valentin Dochot from Brussels. He wants to hear from you some insights about cases that you've witnessed firsthand, illnesses or extreme wounds in Gaza.
Actually, I would say that what you can see is, in general, is the typical wounds that you can find in a war context. So mainly are burns, wound related to crash syndrome, so a collapsing building, fractures. They are the typical wounds that you can see in war context. After there are many stories. Unfortunately, what we were seeing was a lot of children, because the big difference, if you compare with the other context, is that here the people don't have a place where to live. They cannot go away. That's if we compare, like in Ukraine. I was in Ukraine when there was. Immediately after that it was started. Initially, you had many women and children involved, but after a short time, the people was evacuating, was going in safer area. This is not possible in Gaza. In Gaza, people doesn't have a place. They don't have a place where to go. So automatically, children and women are involved, and you can see a lot in the ER, in the operating theater. That's something that is a big difference if you compare with other contexts.
We also have another question online about malnutrition. If we have treated patients with malnutrition, and if so, what was the scale of need and the treatment provided to them?
So to go on the practical part, no one in this moment is treating malnutrition, because the supply needs time to enter. Is a process that is not very fast. So what is entering, the supply that are entering are still the supply that were ready when the war started. And no one at that moment could think that malnutrition would have been a problem, because no one was expecting what we are facing now. Malnutrition is a problem that is increasing. We can see day by day, and so now every organization is starting to start with the malnutrition project. The other problem is that food is completely missing in Gaza. There is no food. People is starving. So it's not easy to start a malnutrition project when no one has food. I mean, we cannot think to import in a short time food for everyone. So in this moment, what is needed really is a blanket distribution of food for everyone, more than something only for children. That is the category that is more involved in malnutrition. Do you want to add?
Just to complement Enrico's answer, I think we're also seeing other diseases such as respiratory tract infections, respiratory disease due to the living conditions and the cold, as well as the lack of basic nutrition, which of course makes people more vulnerable. Diarrheal disease is also a huge concern, and the Ministry of Health is reporting outbreaks of diarrheal disease all over the place. Children, babies, children under 5 and women are more vulnerable in terms of diarrheal disease, and diseases like diarrhea can also contribute to the development of malnutrition. So the global situation is extremely worrying in terms of the public health situation in the Gaza Strip and the worsening of the conditions on the ground.
We have a question from News Nation, Tanya Nouri in Washington, D.C., about the lack of medical supplies and how is it working under this extreme lack of medical supplies across the Strip? Maybe it's
personally, we didn't face a lack of medical supply. We always had the supply that we needed, but to arrive at this point, we are saving supply. I mean, we are using as less as possible supply because we don't know if tomorrow supply will enter and we will have enough. So we have been, we managed to have enough, the minimal enough to run the operation, but is not what usually we would use in a normal context. So as Doctor Without Borders, we didn't face this problem, but we were very often or several times we have been very close to don't have enough supply. We heard that in other hospital they were facing lack of supply, but as my experience, we didn't.
We know from speaking to our teams in places like Jabalia, speaking to our MOH colleagues, that there's a huge paucity of medical supplies throughout the Gaza Strip. The north of Wadi Gaza, there hasn't been any delivery of medical aid there since November, I understand. And yeah, I think people are basically working with you know, what their bare hands. We've heard harrowing stories of amputations being done without anesthesia, for example, and the testimonies that I'm hearing from our staff in Gaza in places where we cannot reach as international staff, they are reporting, yeah, working with literally nothing, and also, of course, not having access to food and clean water as well.
There's a question about the humanitarian aid to the north of Gaza Strip and the fact that it was blocked by the Israeli authorities. How far MSF coordinates with the Israeli side to ensure the entry of these supplies, and have we faced constraints ourselves for the delivery of humanitarian aid to the north?
Okay, so I have to try to be straight. Yes, of course, we have to coordinate with the Israelis. We make many requests to have access to the north, not only the north, of course, also the south. Unfortunately, our requests often go unacknowledged, or we are met with refusals. As I mentioned before, we haven't had any opportunity to deliver anything to the north since November. WHO has also been facing the same challenges. We have made repeated requests for deconflicted movements to allow us to access the north and to support our medical teams there in order that they can still carry out their work. So this is a key point for us. We need unhindered and free humanitarian access. Linked to that, of course, is one of our main calls, which is a call for an immediate and complete ceasefire. This will allow us to reach everybody with the appropriate supplies in the most efficient way. Currently, the situation is absolutely dire. Luckily, as Enrico said, we're able to support our own activities in a very hand-to-mouth way, but beyond that, I think the situation is catastrophic, and we need unhindered humanitarian access as soon as possible, and we need a ceasefire to allow us to work properly.
Okay, so maybe we can take some questions from journalists in the room, please.
مساء الخير. أنا اسمي وائل مجدي من وكالة سبوتنيك. يعني كنت أوجه سؤالي للدكتور باعتباره من أحد شهود العيان على الوضع الصحي في قطاع غزة. يعني كيف كنتم تتعاملون مع الحالات الحرجة والعمليات في ظل نقص الأدوية والمعدات؟ هل فعلا كنتم تفاضلون بين المرضى الذي سيتم إنقاذهم؟ شكرا.
Fortunately, our problem has not been medication. We had enough. The big problem that we had was the space. Sometimes we had to choose because we didn't have beds where to put the patient after the surgery. So the patient after the surgery, they were still inside the OT because there was not a place where to move. So we couldn't use the operation theater for the next patient. That was the bigger challenge that we had, was really the space inside the hospital for the patient. As medication, we had the minimal amount that was necessary to treat the patient. But this is the reality that I lived. I'm not saying that in other place, in other hospital is the same. For example, in the north, for sure, they are suffering a lot about supply and they don't have enough. That is what I've been told from people that has contact with who is still working in the north.
There is a question online about the number of hospitals that are continued to be operative in Gaza, if I can handle this one. So according to the latest WHO statistics from last week, 15 out of 36 hospitals are operating in Gaza today. So we have another question online about if MSF teams and the hospitals that we support or run have any concerns about outbreak of diseases.
Thank you. Yes, as I mentioned before, the Ministry of Health is already reporting outbreaks of diarrheal disease and respiratory disease. In terms of figures, we don't have exact numbers, but I think it's fair to say, given the conditions on the ground, that these outbreaks are going to continue to grow and to affect more and more vulnerable people. At the moment, we're currently not able to treat such diseases. Primary health care is hugely important. In order to support medical treatment of these diseases, we need to go back to one of our main points, which is unhindered access to humanitarian activities.
Any questions in the room? So we have a question online from Russia today. About how we dealt with the lack of equipments in the hospitals that we support.
As I said before, in terms of lack of equipment in our hospital or the hospital supported by Doctors Without Borders, We are just saving as much as possible what we have. So this means we use what is really needed, and sometimes not in the quantities that we would use in a normal context. In this way, we never face a completely lack of equipment. The same is not for other hospitals that are in the north, that are more difficult to reach in terms of supply.
We have a question from AGI, press agency in Italy, about the situation of pregnant women. What are the needs of pregnant women and what MSF has been able to provide so far?
Yes, the needs of pregnant women are huge. One of our health facilities in Rafah are supporting pregnant women, prenatal care, delivery and postnatal care. What we know in terms of the broader situation is that women are delivering with absolutely zero medical care whatsoever. They're extremely vulnerable, and the newborn infants are extremely vulnerable. They're facing cold, they're facing lack of shelter, they're facing lack of food and clean water. So we're extremely concerned for the increasing morbidity and mortality that we are seeing among pregnant women and their newborn children.
If can add, at the moment there is only 2 hospitals in Gaza, one in the south, and that is Emirati hospital that is supported by Doctors Without Borders, and the second hospital in the middle area, allowed hospital. And the problem that in the middle area is this hospital is in a very unsafe area, so pregnant women are not going to the hospital to deliver, and this is a very high risk in terms of mortality and disease.
There's also a question online about the process to get an authorization for the entry of medical supplies and food into Gaza. Yeah, so MSF coordinates with whoever it takes that we ensure the entry of medical supplies. In previous months, we've been working closely with the Egyptian Red Crescent, and also some of MSF's medical supplies were transferred on WHO planes. So we continue to coordinate with all parties involved to ensure the entry of supplies. What we've seen recently was really a delay and slow in terms of the rhythm of the channels to coordinate those entries, but we continue to ensure the needed coordination from our side. Yeah. Please.
Can you hear me? Yeah. Okay. Good evening. Edward Ropsy from France 24. About those supplies and trends, Egyptian authorities are blaming Israelis for all the delay. They say it takes 6 or 7 hours by truck. Did you face to this problem on the Israeli side? Not sure if it was clear enough. How long it takes for one truck to make supplies enter?
What we know about the entry of supplies in general, that the entry points were not enough, because even before the embargo was more restricted on the 7th of October, what used to enter Gaza was not sufficient enough. So what happened is that now we started to see more and more a decrease in the space of delivering those supplies. The problem is not just about the numbers of trucks or how quick the trucks come in. The whole mechanism of coordinating the entry of supplies was not put in a rhythm that is quick enough to cover the immense needs that continue to happen in Gaza. And that's why the only exit for this situation is an unconditional and sustained ceasefire. This is the only way to make sure that the humanitarian space is ensured in this trip.
From my side, I'm medical, so I don't have idea of the process, or I have really an idea of what's happening before, but I can just say how we use what we receive and how we plan the use of supply according to what we have available. So I don't have anything to add.
And maybe what we can also say is that even during the previous pause, the temporary pause, what entered in Gaza Strip did not even reach half of the numbers of quantities that used to enter Gaza before October 7th. So even in the best case scenario, where some trucks were allowed, when there was a pause, what entered did not even cover half of the needs that were really in need for people inside Gaza on ground. There's a question about targeting ambulances and hospitals directly and the impact of this on the delivery of medical aid.
What I face in the month that I've been there, fortunately, and I've not been in a hospital that has been targeted, so I didn't face this problem. For sure, I know that last week there was some ambulance that have been targeted. In particular, a few days ago, one ambulance of a Palestinian Red Crescent, has been targeted. About the hospital, I know exactly the information that you have, the one that are public, but we have not been. I've not been in a hospital target. Al-Aqsa Hospital, 3 days after that we evacuated, has been indirectly targeted, means that a building in front has been targeted and a part collapsed on the gate of the hospital, where usually we had our cars and our drivers. But we have not been in hospital that has been targeted directly.
I'd like to add that 4 members of MSF staff have been killed since the beginning of the war, in addition to numerous family members who've been severely injured. We notify our presence everywhere we work to all parties, and hospitals should be respected as places of humanitarian sanctity. This has not been the case. We've witnessed this directly ourselves on several occasions during the beginning of the conflict.
There is a question about the intensity of the attacks on healthcare centers, if they were less intense now if compared to the previous 2 months.
I don't have an answer. I mean, I was not there in the 2 months ago, so I cannot compare. I'm speaking of what I saw, what I've been witnessed, so I can't answer in this moment. In this month, in the hospital where I've been, has not been attacked. This is what I can say.
Maybe we can also add that from a very fundamental humanitarian perspective, and also according to the international humanitarian law, nothing justifies attacking hospitals. And we should also remember the UN Security Council resolution 2286, of which in theory has provided immunity not only to health facilities, but also to private medical organizations like MSF, and the protection should really extend to anything that provide health care to those in need. Any questions in the room? Yes.
سمعنا أن هناك العديد من العمليات الجراحية التي أجريت في قطاع غزة بدون مخدر. هل شاهدتم هذه النوعية من العمليات الجراحية؟ ومن يتحمل مسؤولية ما يحدث في غزة، خاصة أن مصر أعلنت بأنها تريد إرسال المساعدات اللازمة والكافية لقطاع غزة وللفلسطينيين، لكن دائما إسرائيل تضع عراقيل وشروط تمنع وصول هذه المساعدات إلى الجانب الفلسطيني؟
Fortunately, as Doctor Without Borders, when we were working, we didn't have this problem. We always had the medication that we needed, painkiller and anesthetic in particular. I heard the same. I saw some video about this, but it's something that we didn't face. I didn't face directly. So I'm aware of this information, but it's something that we didn't see and we didn't do, fortunately.
At the beginning of the conflict, we did have direct experience of this in Al-Shifa Hospital. Our doctors treated 2 children who'd been injured in the bombing of Al-Ali Hospital. They were referred to Al-Shifa Hospital and they were treated by our surgeon. He was unable to offer them correct general anesthesia, so they had partial amputation. One child had a partial amputation of his foot with very mild sedation only. There was nothing else available to provide proper anesthesia to this child. He was operated on the floor of a waiting room. There was no space in the operating theatre or in a ward for him to receive his medical care. Because of the overcrowding and the huge number of patients who had been coming into Al-Shifa Hospital at that time, his sister had to watch his surgery taking place, and while she was waiting for her operation to happen. This is the kind of situation which our health colleagues are facing every day. And of course, for the patients, this is absolutely not what we want them to suffer. But at the moment, and at that time, this was very early on in the conflict. We had no means to give them the proper medical care and simple things such as making sure that their pain is managed during a surgical procedure. Testimonies from our colleagues in the MOH and our colleagues in other hospitals. I worked in Gaza for 5 years. I have contact with people regularly, and I've heard many stories, tens of stories of exactly this happening. A surgeon who had to amputate the limb of his daughter without any anesthesia in their home while the Israeli tanks were firing artillery shells and damaging the building. So just, to give an example of what healthcare staff were facing on a daily basis in Gaza at the moment.
There is a question online about elderly people and if we have any medical data about receiving and treating also elderly people in MSF-supported hospitals.
At the moment in Gaza, there is a completely lack of medication for chronic disease. So they are not treated all the chronic disease, and this for sure is involving particularly the elderly people. So I would say that they cannot receive the care that health care that usually they have and they need.
I think because of the lack of humanitarian access, the lack of supplies, we see people who have non-communicable diseases. So in Gaza, there is an elderly population who have issues such as diabetes, hypertension, cardiac problems. The only way that their health can be maintained is by the provision of medications and medical support, monitoring of their conditions, etc. Currently, this population is not receiving the medications that they need. So we start to see complications of this. Directly as MSF, I don't think we've received any cases, but again, testimony from Ministry of Health colleagues shows that people are coming with heart attacks, strokes, and in the end stage of diseases like diabetes, where normally, these complications should be preventable. Dialysis is another issue. There are very few dialysis beds available currently in the Gaza Strip. I believe there are only 18 dialysis units to serve a population of 2.3 million. It's completely oversubscribed. People have long waiting times, and during the waiting times, their health can be severely compromised and they can face complications and death as a result of this. So indeed, this population are suffering, and their needs need to be also stressed. So thank you for the question.
So I have a question to Enrico. After 2 months of living in Gaza, do you think that there is any way in the near future or even in the distant future for the people in Gaza to live a normal day, just to see again an ordinary day in Gaza?
Normal life, ordinary day in Gaza at this moment, no, you cannot even think about it. Something that is really far and far. For sure, if there is no ceasefire now, immediately, this will never happen. And even if it happen now, will take a very long time to go back to a kind of normal life. But we have to think that Gaza is an area that is, at least in the north part of the middle, is completely destroyed. So I don't know how we can think or to speak about normal life when you don't have a house, when everything around you is completely destroyed, when you have lost everything that you had. We had, speaking with our staff, they were saying, yes, I spent my life to build a house. This was a nurse that was speaking. I bought the house 2 years ago, and now I don't have a house. They send me the picture, friends that are still in the north area. There is nothing now, just some rubbers and nothing more. So to think to a normal life, I don't say no because it's too strong probably, but I don't see how they can go back to a normal life.
So there is a question about what is the most urgent call you make to parties and international community.
So we have 3 key messages. These are messages that we've consistently given since the beginning of the conflict. And I take the opportunity to repeat and to stress them again today. We are calling for an immediate and unconditional ceasefire. This is needed now. We are calling for attacks against hospitals and civilians to stop immediately. And we are calling for the unhindered humanitarian access of aid to Gaza's population. This is the whole spectrum of aid, from medical supplies, fuel, food, and uncontaminated water. They are our 3 main calls.
So there is a question about what is the most urgent call you make to parties and international community.
So we have 3 key messages. These are messages that we've consistently given since the beginning of the conflict. And I take the opportunity to repeat and to stress them again today. We are calling for an immediate and unconditional ceasefire. This is needed now. We are calling for the immediate and unconditional access of aid to Gaza's population. This is the whole spectrum of aid, from medical supplies, fuel, food, and uncontaminated water. They are our 3 main calls.
So the question is, MSF calls for an immediate and unconditional ceasefire, but we think that what's happening in Gaza now is a genocide and a war crime. And there is no hope for a ceasefire without stopping these crimes.
So MSF is not a legitimate organization to legally ascertain whether or not a genocide is taking place. This is the objective of the International Criminal Court, the ICG proceedings, as well as similar proceedings which are happening in other courts throughout the world. However, what we can say is that the situation we are witnessing and denouncing in Gaza is unprecedented in many ways, and we've been consistently sharing our observations and findings in our public communications. The combination of a siege on the whole population, systematic attacks against civilians, the civilian population, and against health facilities, the destruction of the health system, and the forced displacement of hundreds of thousands of people with nowhere safe to go is leading to unbearable levels of suffering in the Gaza Strip. We are extremely worried for the survival of the Gaza population and follow with extreme concern the claims of a risk of genocide, and we reiterate our call for an immediate and sustained ceasefire.
There's a question online about the Israeli allegations of Hamas using the hospitals as a basis for them. Has MSF seen anything that confirms that?
Yeah, no. What I can see that I saw a lot of patients in the hospital, more than 700 patients, thousands of refugees. I didn't ask to the patient if they were affiliated or not. For me and for us, they were just patients. I didn't care if they were one part or the other, are just patients, and we are there to treat the patient.
I can also share a situation that happened in front of Al-Shifa Hospital, in front of MSF teams. An ambulance was attacked with very close proximity to the entrance of the hospital in front of our medical coordinator, and everyone inside that ambulance was just patients, just wounded. So what we have seen so far are just sick people, extremely wounded people in these facilities or even in the ambulances. There's a question from Russia today.
كان هناك بعض الأنباء، لا نعرف إذا كانت مؤكدة أم لا، أن كان هناك استخدام للسلاح البيولوجي ضد الفلسطينيين من الجانب الإسرائيلي. هل بمعاينة الأطباء التابعين لمنظمة بلا حدود تم توثيق أي شيء يخص هذا الأمر، أو سمعتم بعض الشهادات على الأقل من المصابين أو الجرحى تخص استخدام السلاح البيولوجي في هذه الحرب؟
No, we didn't notice, so we didn't have any information about the biological weapons, and what we saw were the common, unfortunately, to say common war wounded, nothing else.
Earlier on in the conflict, we heard reports of patients arriving to hospitals with injuries consistent with white phosphorus burns. I believe many of the Ministry of Health doctors witnessed this, and a report and an investigation was done by Human Rights Watch. So there is some information about that out there, but as MSF, we haven't documented any such injuries so far.
So there's a question from Russia today. Did you feel as doctors that you are helpless in that situation?
Helpless is a nice word. I mean, what we are doing is almost nothing or nothing if we compare with the needs that there are in this moment. For sure, the patient that we treat, we can make the difference for them, but the needs that there are in this moment in Gaza are absolutely huge. So what our impact is very, very low because there are almost 2 million of people in need of health care. And as Doctors Without Borders and the other organization, in the context that we are now, if you compare with the needs that there are, what we are doing is really a drop in the ocean, not in the sea.
If I can just echo Enrico's point, using a quote from our international president, Dr. Christos Christou, who wrapped up a visit to Palestine a few weeks back. He said that doctors cannot stop bombings. We can only treat wounded and patients, but we cannot do miracles. So,
yeah, for sure. Often we speak about humanitarian activity, but what we are doing now is not a humanitarian activity. Humanitarian activity means to try to give an answer to the needs of the people. But you cannot give an answer or support the needs of a population when you don't have a supply, when you don't have food, when you don't have shelters. So what we are doing now is not a humanitarian activity. It's really to try to give the support that we are able to give, but it's nothing compared with the needs that there are.
There is a question about our Palestinian team members, the local staff inside Gaza. How do they cope with the situation on ground, knowing that they are affected by what's happening themselves?
I think that is absolutely impressive how they are able to react. I was working, our team, the team that I was working with is about, I say was because I left, about 60 medical staff, plus the logistic, all the rest of the staff, and it's impressive because they are refugees. There were some colleagues that already changed 9 times the place where they were living, tries to survive because it's not to live. So for 9 times they have to move from one place to another because they were always moving in a place that after a while was becoming too unsafe or had an evacuation order. And they're still trying to arrive to work every day because sometimes they're not able because it's too unsafe, or they don't find the transportation, or there are a lot of issues, or sometimes some relative have been killed by bombing. But every day they still try to go, and they come to work with a smile, and it's something that is impressive how they can cope with a situation like this.
So maybe we can take one last question about the mental health situation of the wounded that we treat and the psychological impact of the situation in Gaza today.
I would say that it is still too early to see the real psychological impact. The people is still trying to survive, so they are really busy in to try to find food, and so you don't see a lot of mental issue, a lot of need in terms of mental health support. We are we are offering in our service mental health support. We were doing the hospital mainly for the children that are the more affected, because they don't understand obviously why they're living this situation. I think that the huge need will be very soon when people will arrive to a stable condition, and at that moment the thing will explode, the issue will explode. So what we are facing now is, what we are focusing now is mainly mental health for children, because are the more affected.
Any more questions? So we'd like to thank you so much for your engagement, for the journalists online and journalists in the room. We encourage you, please, to be in touch with our press officer, May, here in Cairo. She will provide you more information and follow-up in case you have any follow-up questions. Now we give the space for interviews with our colleagues. Thank you so much, Enrico. Thank you so much, Helen. And with this, we wrap up the press conference. Thank you. I also started to notice that there was some sort of a circle that was a heat, you know? Is that more?
مش فاتح الشرف
أهلا وسهلا فيك.
ممكن اقدر اخد مايك من
استنسخت الفضلات وتشوف زميلتنا مي، زميلتنا مي.
الشرق بونجر.
Yes. Enrico, would you like to make a small break, or you proceed to
Just go to the bathroom, and
go.
after I'm ready.
Do your thing. Do your thing.
زوم الموبايل كده